Hi, my name is Juan Duarte, and in this video, I'm going to go and talk about a case scenario involving an 81-year-old female that is presented to your office. She is 5'4", weighing approximately 142 pounds, with a blood pressure reading of 122/84. She has diabetes mellitus type 2 and rheumatic disease with a resultant heart murmur. She is allergic to penicillin, photosensitive sensitive to tetracyclines, and has an atrial fibrillation. The medications that she is currently taking are insulin, which helps control blood glucose levels by signaling the liver and muscle, and fat cells to take in glucose from the blood. Insulin, therefore, helps cells take in glucose to be used for energy. Another medication she is taking right now is warfarin. Warfarin is a blood thinner. It can treat and prevent blood clots, and she is also taking vitamin A. Vitamin A is important for normal vision, the immune system, and reproduction. Vitamin A is also helps the heart, lungs, kidneys, and other organs work properly. The patient has had rheumatic fever as a child and was diagnosed with diabetes at age 52. Lately, her appetite has been poor, and her caregiver reports frequent disorientation. The patient complains of pain and tingling in her right arm. The patient has experienced this pain for the last month, and the pain and the tingling is increasing. The patient also states that she has had back pain in her lower right side, and she's beginning to have difficulty urinating. So, in my perspective and what I think, after reading the patient's file, I will go ahead and ask four different questions. Well, multiple questions, but these four questions are very important. The first question is, from my standpoint, what exams would I prepare for the patient? Well, I would obviously check her vitals. Once her vitals have been done, I would also do a blood pressure test. The reason for the blood pressure test is for due to the fact that she is diabetic, so I want to make sure that her blood pressure levels are okay, and also a cholesterol test. Okay, and I would perform a urine test just to see if there's anything um, bad in her urine and her blood. But again, she is having a difficult time urinating. Two, what further questions can I ask to clarify the chief complaint at hand? So she said that she is having pain. She's having pain on uh she's having pain and tingling in her right arm, and that she's experiencing pain for the last month, and the pain and the tingling is increasing. So I would ask her, did she fall? And if she did fall, was there an injury in the fall? And if there wasn't, then I will go ahead and ask what makes the pain better and what makes the pain worse. Um, and questions that I would also ask is, are you experiencing any other pain other than your back, or her arm? And also, lastly, what I think, this is my question for myself because I want to go ahead and see it. Maybe we can diagnose the issue. Because she is having difficulty urinating, she is having back pain on her lower right side, and she is experiencing some pain um, and tingling in her right arm. I want to ask, is she drinking enough water? The reason for that is because I think maybe it's her kidneys. Maybe she's developing um, stones in her kidneys that is maybe blocking the pathway to her urinating, and the ureters. So maybe my perspective, I think maybe she is in the beginning stages of developing stones that may affect her urinating, which would be very, very painful. So I ask, are you drinking enough water? How many times a day are you drinking water? And also, are you eating enough? What have you been eating lately? Because she is also diabetic. She has diabetes mellitus type 2. It's very important to make sure that you ask her what types of foods has she been eating, um, due to the fact that her caregiver reports that she uh, has freaking disorientation because she's hardly eating because she has had a poor appetite. Now, three, what yearly physical exams should you follow up to verify that the patient has had? So, um, um, cholesterol test. The reason why I would do a cholesterol test is because due to her diabetes, mellitus, type 2, a kidney test. Due to the fact that I want to make sure her kidneys are working properly, because she is having a difficult time urinating. Um, and also a echogram. This test uses sound waves to check the heart's chambers and valves due to the fact that she has a rheumatic disease with the resultant murmur. So this involves the heart. So I want to make sure that her heart's um, working properly fine, especially the fact that she is 81 years old. So tests like these are very important. Also, other exams that she yearly physical exams that you should follow up to verify the patient has had is a pap smear and hemoglobin A1C done and an electrocardiogram ECG, cardiac MRI, and blood test. What specialty doctor and could the physician send the patient to? I would suggest a nephrologist due to the fact that she is having a difficult time urinating, and that the pain is radiating, that she is experiencing pain on her right side, her lower back. So, those cases, the fact that she's also having a loss of appetite and she reports freaking disorientation, she might be dehydrated, she maybe isn't intaking enough water, um, and that sort of nature. So, I would suggest um, sending her to a specialty doctor such as a nephrologist just to get that checked out. Also, due to the fact that she is diabetic with mellitus type 2, so it is very important that she's drinking enough water. And that this concludes the video. Thank you.